I'll be performing a joint mobilization to the patient's right shoulder. So the patient is coming in with increased pain during the motion of shoulder flexion. So with that motion, I'll be providing the patient with a grade 2 posterior glide joint mobilization to that right glenohumeral joint. And prior to starting, I would assess the patient's pain levels based on the VAS. Patient, when you perform this motion of like reaching overhead, if you want to go ahead and perform it and let me know your pain rating from a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever felt. So go ahead and then let me know.
I have about 5 out of 10 pain, like right here.
Right there?
Yeah.
Okay, so about 90 degrees of shoulder flexion, and patient stated that she has 5 out of 10 pain. So to set her up, I would have her in that open pack position for the shoulder. So that's going to be about 55 degrees of abduction and then 30 degrees of horizontal adduction. And then I'm going to be applying that grade 2 joint mobilization to the shoulder. Typically treatment would be for about 3 minutes with 45 seconds on of the oscillations and then a 15-second rest. But for the purpose of this video, I will be doing it for 30 seconds. So what I'm doing currently is just obviously providing that posterior glide to the shoulder, but most importantly, performing it within the starting resting position to about mid-range for the joint capsule. And I'm providing about a slower oscillation for sure in comparison to that grade 1 joint mobilization. So just kind of lightly pushing, releasing, pushing, releasing. All right. Then after doing this, at least for now, for about 30 seconds, I'll go ahead and have the patient again. So patient, if you'll go ahead and perform that motion of shoulder flexion, so reaching overhead, and let me know your pain level, if it's changed at all.
I think it's more like a 4 out of 10 now.
4 out of 10. All
Yeah.
right, so we've seen a decrease of 5 out of 10 to 4 out of 10. And with this, what we're hoping for is for the possibility in the future of the pain of the patient being able to perform those overhead activities, reaching activities with no pain. So the patient was able to tolerate this intervention, so it was successful.